Lauren, first of all, I just want to get your thoughts on, we heard a bit about COVID and the response, and then, the swine flu was brought into it at some point, the U.S. presidential debate. Were they discussing the right topics?
I think the key right now is to move forward, and I didn't feel like I got enough of that. I wanted to hear both candidates' plans to push us out of where we are now. 1 million global deaths, 200,000 deaths in the United States. What are the next steps? What are the plans to move forward? Let's not look back to what's happened. Let's move forward, learn from the lessons. I mean, swine flu, we should learn from the lessons of past outbreaks and past pandemics, but it's not relevant to talk about that in the short amount of time that we have in a debate.
Lauren, one of the things I keep on hearing and reading more and more about is even if we have a vaccine, a viable vaccine in the next couple of months, it won't completely eradicate COVID-19. Are we going to see restrictions in place for, a lot longer, even if we have a viable vaccine?
I think we'll probably see varying degrees of restrictions. They'll be state by state. They'll be local to what's happening in sort of local context outbreaks. So smaller clusters may require more stringent requirements in those communities. But as we move towards a vaccine, I think the hope is that we'll prioritize vulnerable populations, we'll prioritize frontline workers, we'll set those strategies forward so that we can move to sort of quote unquote back to normal as quick as possible.
What can you tell us about some of the antibody tests that have been making the news?
Yeah, there's a lot of testing news that's been happening over the last few weeks. We've heard about antibody tests. We've heard about antigen tests. We've heard about, traditional PCR tests. And so I think we are moving towards a better national strategy for testing. The antibody tests are important in understanding the scope of the infection in the United States, how many people have been infected, how many people have those antibodies and may potentially be protected, at least in the short term from COVID-19 reinfection. The antigen tests that were talked about by the White House earlier this week may be an inexpensive, easy to roll out strategy for understanding the burden of disease, the prevalence or the incidence locally and nationally. So they're easy to use, they're quick, they're not as effective as those PCR diagnostics or even some of the point of cares, but we can use them quickly and rapidly and routinely to get a better picture of infection in the U.S.
We also have early data showing some promising results for Regeneron's antibody cocktail to fight coronavirus. Is it really early, or are you comfortable with the fact that it's going in the right direction?
It's early, but I think it's really promising news. It's exciting to see this moving forward. These monoclonals can help, especially early in infection, so they can be used for post-exposure prophylaxis a lot of times. So if someone's had an exposure but hasn't yet developed disease or seroconverted. And so it's exciting to see the news from Regeneron because we think of these as, you can think of these as like a bridge. As we're waiting for a vaccine, we can use these monoclonal antibodies early in infection, which is a good tool in the toolkit for sure. And hopefully we'll see that move probably towards either approval or emergency use authorization, depending on the data.
Lauren, in 20 seconds, I mean, we also, the J&J vaccine is 1 dose. Would that make a difference to how many people actually would take it?
I think absolutely. It's really important to have these 1-dose vaccines because that follow-up, we lose people. We know we lose people, and we know that is a consistent way in which vaccine is not complete. And so if we can have a 1-dose vaccine that can be rolled out and you've gone to your doctor, gotten your vaccine, you've checked your box, and you move on, that makes getting vaccine to more people easier, and getting vaccine in the way it's expected and supposed to be and studied all the better.